So, hello everyone. Welcome to our UU Virtual Roundtable. My name is Sarah Reyes and I will be today's moderator. Before we begin, I want to take some time to remind everyone that we are recording these sessions and we will be uploading them onto the UUCLC YouTube page. And it's just a good resource to have if you ever want to share these videos with other people or just go back and rewatch them yourself. So that's one thing. The second thing that I want to bring up is that we ask that you remain muted during the presentation section, just while our speaker, kind of discusses the topic. After this, we will open up the session for a little Q&A section afterwards, in which you can have any discussion, comments, concerns, things like that. And with that said, I hope you enjoyed today's roundtable session.
Yeah, okay, let me just introduce Amy and where I met her. I'm going, have been going for about a month because I have a short shoulder. And so Amy got me on a routine and, went through exercises and helped me to get better. And so that's where I met her at the physical. She's a physical therapist there. So with that, Amy, you can take over.
Okay. Thank you, Paul. Thanks for inviting me to speak at the Unitarian Universal Virtual Roundtable, and I'm happy to be here. As Paul said, I'm a physical therapist and I practice in an outpatient orthopedic setting, specializing in back pain, joint pain, and chronic pain. And I also am an educator of students and of practitioners and of the public. So this is right up my alley. I was very excited when Paul asked me to speak on the importance of exercise as we age, because it's actually a passion of mine. And one of my favorite parts about my job is that I get to work with people and see the effects of lifestyle and choices on their physical health. And so I've been lucky to treat folks in their 80s who are recovering from a shoulder injury, say, and trying to get back on the ski slopes.
I'm not trying to get back on the ski slope. I just want to get healthy.
Maybe that's not Paul, but that has occurred. And then I've also been able to work with folks in their 20s who are less healthy than some of the older folks I've treated because of lifestyle and choices. And so early on, I treated this man who said something to me that has stayed with me for many years, and he had a real priority for exercising and staying healthy and being in charge of his healthcare destiny. And I asked him, what was it that made him so deliberate and conscientious about such choices? And he said, at some point in his life, he realized that aging is a one-way trip. And I've never forgotten that. And I really have taken that on personally, as well as tried to share that with other folks, just that mentality that we get one chance to do this well, and you can do it very well. And so today I'm going to talk about exercise and aging and relationship to basically aging well. So you are all probably aware that we have an epidemic, a worldwide epidemic, and we have a vaccine. And the epidemic I'm talking about today is the epidemic of physical inactivity, which is a worldwide epidemic, and there is a vaccine. And physical inactivity is a leading cause of death in the world. And 80% of Americans are not meeting the daily recommendations for physical activity. It's 80% of Americans. So we're going to talk about what are those physical activity guidelines, but I want to talk a little bit about exercise as medicine. Exercise is medicine. In fact, I saw a physician one time give a talk, and he said, when patients come into his clinic with lots of chronic diseases, such as heart disease, hypertension, diabetes, obesity, he basically takes out his referral pad and he says, I can write you a medicine for your hypertension. Gives him a piece of paper. Then he says, I can write you a medicine for your diabetes. I'm going to write you a medicine for your dementia. Or I can write you a script for one medicine. It's free, and there are no dangerous side effects. Which would you like? This stack or this one? And the one is exercise. And so today I just want to give you a little bit of the current scientific evidence on exercise as medicine in both treatment and prevention of most chronic diseases and as many as 13 cancers. Just a little disclaimer here, I'm not against medication. Okay, so that is not the message I want to portray today. And also, I'm going to be talking about general exercise versus specific exercise. And what I mean by that is general exercise, which is, we're going to define that a little bit more later in the session, but specific exercise is what you do for a specific injury, a shoulder pain, a back pain, recovering from a surgery, nerve pain. So there are specific exercises. And today I'm talking about general exercise and fitness. The British Journal of Sports Medicine put out a statement that said, anyone at risk for chronic disease should consider exercise an essential vaccine to greatly lower risk and almost certainly extend their life. Healthcare providers in the last 7 or 8 years have been urged to influence patients to adopt exercise and other healthy lifestyle behaviors. And what you probably know is there is a linear relationship between physical activity and health. The fitter you are, the more active you are, the longer we live. But what you're also probably aware of, but maybe it hasn't been articulated to you, is that not only does exercise increase your lifespan, it increases your health span. And the difference between health span and lifespan is not how long you live, but a health span is how long do you live healthy and active. And they are not always the same, unfortunately. You might not know all of the diseases that regular physical activity both treats and prevents. So I want to actually read a list to you. Okay, so these are from American College of Sports Medicine, British Journal of Sports Medicine, and the American Heart Association. Physical activity prevents and treats hypertension or high blood pressure, type 2 diabetes, pre-diabetes or metabolic disease, heart disease, stroke, obesity, cognitive decline, including dementia and Alzheimer's, 13 types of cancers, especially breast, colon, lung, and cancers of the digestive tract, depression, anxiety, and also, of course, decreases risk for falls and fall-related injuries, helps decrease weight gain, and improve weight management. This is regardless of age, ethnicity, race, nationality, or gender. And because this is no longer news, healthcare providers have been urged to take action. In fact, when you see your primary care provider, your physician, you may have been asked in recent years, what is your activity on a weekly basis? It's now being described as the 5th vital sign. So in addition to heart rate, blood pressure, temperature, primary care physicians are being urged to get a measurement of the 5th vital sign or physical activity level. Because being inactive or sedentary is actually a greater risk factor for mortality than mild to moderate hypertension or being overweight, and potentially a greater risk factor than smoking, type 2 diabetes, or high cholesterol. And the reasons why people are unhealthy is at least 50% due to health behaviors, lack of exercise, among others. And that number is actually growing. I've heard as much as 97%. Okay, so reasons for being unhealthy might be up to 97% direct result of our health behaviors, meaning that leaves 3% for genetics, environment, etc. So, you know, this number 50% is growing, and I think over time we're going to see that 50% control we have over our health, at least 50%, is going to grow, and we're going to actually learn more that we are largely in charge of our healthcare destiny, versus a more passive approach that says, I have a family history of X, Y, and Z, and it is inevitable that I will develop that disease. We also now know that an exercise program is as or more effective than commonly prescribed drugs at treating cardiovascular disease, diabetes, and stroke. So if there was a pill as robust as general exercise that could both treat and prevent dozens of diseases, including up to 13 types of cancers, prevent disability, improve mental health, and was free and had no dangerous side effects, if there was a pill that did that, healthcare providers would lose their license for not prescribing it. And there is no other single intervention or treatment or procedure or injection that is associated with such a diverse array of benefits. I'm going to repeat that. There is no other single intervention or treatment that is associated with such a diverse array of benefits. And so, you know, much like what I said about how inspired I was by that gentleman I was lucky to meet that said aging is a one-way trip, this news to me is really exciting. You know, it's very exciting to think that you can mostly or totally control the way you age, control what diseases you get, control how you manage diseases, control how you treat diseases, prevent diseases based on having a healthy lifestyle. The American Heart Association put out a statement that said, exercise is medicine that every person needs to take and that practitioners should be prescribing. And so how do practitioners do that? Is a bit of a challenge because, you know, the culture of healthcare, it's difficult to incorporate that into a culture that sort of looks for sometimes and expects medication. And also providers don't necessarily think they can influence a person's behavior. And so sometimes the time is not spent on educating folks on how to implement this treatment. So that's changing. And I think, you know, we have this imperative for many medical associations that must change. And I'll be curious to ask you here in a bit when we have these questions if anyone has been asked about their fitness program by a provider. So you can calculate your own fifth vital sign, and some healthcare providers are starting to track it with the other vital signs. So how do you track your health, your activity level, or your fifth vital sign, your fitness level? It's basically how many minutes at a time do you exercise at a moderate or greater intensity, and how many times per week? Okay, so for example, if I were to ask you how many days a week do you exercise, and you said 3 to 4, and for how long? 20 minutes, then I would say 3 times 20 equals 60. 60 minutes per week minimum. So the guideline of physical activity from the College of Sports Medicine is minimum 150 minutes per week of moderate intensity or greater physical activity. Okay, so that's not very specific. For some people, that is running, hiking. For some people, it's doing exercises in a chair. For some people, it's gardening. So it's moderate intensity for 150 minutes per week. And so that's the minimum guideline. And 80% of Americans don't meet this guideline. What is the right level for each person? Of course, depends on your abilities. What can you do safely? What's your baseline activity? If you're already someone exercising 150 minutes or more per week at a moderate intensity, and you've been doing the same thing for 5-10 years, sometimes you need a little shock to your system. Sometimes you need to change it up a little bit. Sometimes you need to increase the intensity if you're not managing your health effectively. Starting small and building is always the recommendation. So for some folks, going from 0 minutes per week to 150 minutes per week is not possible physically, nor can that person necessarily wrap their head around it mentally. So small changes, very small changes, have been shown to improve cardiac and metabolic health. So anything you can do, a person can do to move towards that minimum guideline is is always an improvement, and you can see changes in your physical health. Of course, we have to consider abilities, and maybe your ability is limited by a physical injury or impairment that you need to address first with specific exercise or a better management strategy so that you can do general exercise for your overall health. Preferences are big. When I help kind of counsel people on this, I always bring preferences into the conversation, like, do you like to be inside or outside? Do you like to be alone or in a group? Do you like to have someone guiding you? And maybe you need a class where someone tells you what to do, or you meet with a fitness professional one-on-one. These things are important because we need to find solutions for people that they are likely to stick to. So preferences are huge. I would never advise someone who wants to exercise outside by themselves to go to a gym when we can go to gyms again, to go to a gym and take an exercise class. Okay, so we have to work around people's preferences. You have to identify your preferences so that your consistency is more likely to be good in your adherence to a program. Journaling or tracking progress has been shown to help people stay committed, stay consistent. So, even something like writing on a calendar or establishing a fitness journal where you track what you're doing on a weekly basis. Some physicians will actually help you, or some healthcare providers will help you outline a program. This is what we're hopefully moving towards, to where you both agree on something and you track it. And then there's a follow-up schedule where you actually will go over it with your healthcare provider to check your progress. And that accountability helps some folks out. And then, you could just keep monitoring your fifth vital sign, your activity level, and journaling that to see, are you moving towards that 150 minutes on a regular basis, 150 minutes or more? So I think that there's a website, it's called exerciseismedicine.org. And it's a big movement with College of Sports Medicine, joint effort with University of Washington. Exerciseismedicine.org. So there's some good references in there. If you're a science nerd like me and you want to read about that kind of stuff, or if you just want some general guidelines about how does a person implement this, what about all the limitations we have right now with COVID? So there's some good discussion on there about how do we set ourselves up for success in meeting this minimum guideline. So I'd just like to read the list of diseases again, and then I can maybe turn it over to you for questions and comments. But so the guideline again is 150 or more minutes per week of moderate or greater activity, continuous, purposeful movement. Again, it's individual to you and where you're starting and what are your limitations. It decreases the risk of new diseases as well as decreases the progression of chronic diseases, including up to 13 types of cancer, especially cancers of the digestive tract, lung, and breast. Decreases incidence of cognitive decline, including dementia and Alzheimer's. Decreases depression, anxiety, weight gain, heart disease, diabetes, metabolic disease, stroke, obesity, prediabetes, and decreases fall risk and fall-related injuries. So I thank you for letting me present some of this data, and I would love to hear any questions, or if anyone wants to share a story that maybe they, if anyone was actually asked about their fitness level or counseled on it by a healthcare provider.
So, okay, everybody, you can turn off your, put on your stop video and mute them. And hopefully somebody got some questions or comments. Anyone? You know, if you want to get healthy, exercise.
Hi, this is Jack. Amy, thank you very much for that great presentation.
You're
I read
welcome.
a journal article from the American Academy of Sciences a few years back, which is a very prestigious organization, that adults had better mental acuity during periods of fitness. That's the good news. The not so good news is once they lost the fitness, they lost the benefit as well. So it's something that, as your source said, it's a one-way street, and you must maintain it.
Yes, thank you for sharing that. Yes, that just kind of is, I guess, more motivation to stay consistent in order that we can't exercise for 3 or 4 weeks and then stay healthy. We have to stay the course.
Yeah.
Easier said than done.
Anyone else?
I think the pandemic has really cut down on people's activities. It's a shame that, you know, you can't go anywhere, so a lot of people just end up sitting around and watching TV or reading. I don't know what they do.
No, it's a real block to fitness, especially for the folks that prefer, I want to be at a gym, I want to be in a class, I want an instructor. It's very hard. And I've even had a lot of patients tell me, you know, in the last year, even runners and hikers and bikers, they're limited to, you know, thank goodness we have nature, and nature is, you can't take that away. But mentally, you know, just the way people are dealing with the pandemic does make it a little bit harder, I think, to stay motivated to go outside and be consistent with the fitness program. So it is hard right now. Does take maybe a different kind of a willingness to change your exercise preferences for a while. It's a very real thing. And in the last year, I'm gonna say at least 50% of the new people I've seen in the clinic, when I'm interviewing them and getting their history, at least 50% of the problems people are dealing with in an orthopedic problems are either, they tell me it's because I've been less active since COVID, or it's because I sit on a computer all day and work from home. So I'm less active and or I'm sitting more. And it's causing more and more physical problems.
Anyone else? Comment, question?
Amy, I'm Gail Trentham. And last week I was at my cardiologist and he did ask me what my physical activity was and how long. So I was glad to report that I'm a walker and for about an hour or so.
That's wonderful. Yeah, I'm glad to hear it. And I'm glad to hear that that your physician is tracking that too.
And that was Dr. Cannon.
Okay, go Dr. Cannon.
Anyone else?
Well, you know, I have always wondered about the when people are saying that it prevents people from falling down, and that's where people get hurt, you know, elderly people. I'm going, why does nobody teach people how to properly fall down? So when they do fall down, they don't hurt themselves. And of course, that comes from my background as a having for decades practiced a martial art,
Oh, yes.
where the first thing they teach you is how to properly fall down. You know, so
Yes.
and not hurt yourself. Because you're being thrown clear across a room, you know.
Yes.
Why are there not classes for elderly people where they do that?
Yes, that's a great question. I'm gonna throw out liability maybe. But I mean, that sounds like an excuse. But so the question, if anyone didn't hear it, was why aren't there classes to teach elderly folks how to fall? That's a great question. I feel like that should probably start much before we get elderly. But it's a motor skill, and the good news is we still learn motor skills. We still respond the same way to exercise as we age. It just takes longer. Sometimes the consequences of not falling well are bigger. But I think it's a great question, and I don't have an answer. I do have a priority though, when I treat patients in the clinic, that I want people to be able to get on and off the floor. There's actually some good research that says your mortality rate is directly related to your ability to get on and off the floor. So that's very interesting. I think it's a super important skill. I know my mom, who's 77, she sends me pictures of her playing with the cutest baby on the planet, which is her great grandbaby, Liam. And I see her on the floor playing with him, and it just makes me happy. I mean, she's not without any orthopedic conditions, but she does it regularly. And so I think that's an important thing that we maintain. But I don't have an answer to your question. I think it's an excellent one.
Maybe you could start a class, Annetta.
Put some mats down, cushion the floor. It could be fun.
Yeah, there are a number of factors that prevent a person from falling, and I assume leg strength is one of them, but vision and balance,
And balance.
and having your home anti-fall by not having things to slip on. So, Annetta, I'm going to work on not falling. In the first
Well, I mean, that is the ideal thing, you know, yeah. But, you know, it's like, I've been practicing Aikido, and the whole thing there is to take someone's balance away, to take them down or throw them, you know, so, yeah.
Yeah, that brings up another good point, that just the fear of falling can be disabling. So some people are limited in their physical activity because they fear falling, or they feel like their balance is off. And you did bring up some good points about what affects balance, and it's vision. It's your what we call it somatosensory, or that means your body, essentially, flexibility, strength, agility. So vision, your body, and then your vestibular system, or your balance system in your ear, and reducing the risks around you. So if those things are problems, that person needs a specific exercise. And we actually have a balance, I'm not here to market, but we do have a very well developed balance program at Physical Mall location, where we do help folks recover their ability to balance. But fear of falling is a big limitation and roadblock for people to get that 150 minutes a week.
I just want to follow up. You were indicating with the COVID, people spending so much time at their desk, at their computer. And I have two sons that that's all they do these days. And my younger son indicated, Dad, I am much more tired than when I used to travel and meet people in their offices than I ever, and you know, with this lack of traveling and sitting at your computer, that is pretty serious stuff.
Mhm.
What should people do that sit at their computer all day to make sure that they're, you know, well, but anyway.
Yeah, it's a very real thing. And I think if you're not an exerciser, you don't fully understand this. If you are an exerciser, you've experienced it, that the exercise actually gives you energy. It might take energy to begin that people don't think they have, but once they do it, it gives them energy. But yeah, so that's a very real thing, Paul, that people are struggling with. And even pre-COVID, when I treat people with sedentary jobs, you know, I really talk to them about, if you sit all day, you have to balance that, right? An exercise program for someone that sits at a desk 8-10 hours a day is very different than an exercise program for a UPS package handler that bends and lifts and squats all
Boy,
day.
ain't that the truth?
So I mean, sitting well, of course, is key. Interrupting it throughout the day as best you can, but then also exercise before and after that stretch of inactivity is crucial. And the people that have the highest incidence or the highest number of back and neck pain, highest incidence of neck and back pain, laborers and sitters.
Wow.
So go use a jackhammer, right? And ride in a bouncy, drive heavy equipment that vibrates all day, or sit at a desk for 8 to 10 hours. Those are the two groups of people that have the most frequently struggle with back and neck pain. In the middle, much less often. So it's just interesting how hard that sitting is on our body. It's not meant to sit.
Anyone else have a comment, question? When we got an
Well,
expert
I'll
here.
just follow up. I saw a DVD a couple of years ago of a doctor who was also a marathon runner. But after he worked out in the morning, he sat the rest of the day. He had a chance blood test, and he found out that he had markers for inflammation, like interleukin-6 and so forth. And he decided and was advocating on this DVD, it's not enough to work out for an hour in the morning and then sit the rest of the day. You must be moving throughout the day. And he used the comment, sitting is the new smoking.
Mm-hmm. Yes.
Oh,
Sitting is the new smoking has been a very powerful campaign. You know, it's really gotten a lot of people's attention. Sitting is the new smoking came out, and then text neck. Have you guys seen the text neck campaign about why we have an epidemic of neck pain and how we flex our head down over 3,000 times a day on average? And why does everyone have degenerative this and that in their neck? And it's largely sitting all day and sitting in poor positions. So those kind of, you know, I don't want to say they're scare tactics, but, you know, smoking gets people's attention. And so we got to link something else of value, like moving to that to get people's attention.
Yeah. Yep. Okay, how about Margaret or BJ? You guys want to comment? Ed? Questions? So, anyone else?
What practical things could we do? You know, I'm still working, and I have, you know, tax season coming up, and you know, COVID is not ending, before the end of the year, I don't think. So what am I supposed to do, like, practically right now?
Okay, that's a great question. So
Went away that I used to be doing,
everything went away that you used to be doing. Okay, that's a great question. So, I mean, obviously, I don't like to give blanket advice because it's a very individual thing depending on where you're starting and what your preferences are, but I will give you blanket advice. My blanket advice is, especially if you're working, you're sitting, you have appointments with people, you're going to be busy for the next few months, it sounds like, is schedule an appointment with yourself. You don't break appointments with your clients, I'm guessing. You schedule it into your calendar on your device or whatever you use first, right? And that is your appointment with you, whether it's I'm going to get up from my desk and go out the door and walk. I'm going to flip my screen to some sort of little movement exercise video that I can do in my office. I'm going to get on the floor and stretch. Whatever that is the more individual part. But I would say the best thing to do in my experience and what the science says is schedule an appointment with yourself before you fill it with everyone else, because it won't happen otherwise if you're trying to squeeze it in on the back end.
Yeah.
That's a challenge. That would be a challenge for you.
Yeah.
She's usually not free until what, midnight?
I know. Yeah, I think I'm one of those people that puts everybody else first, kind of. Yeah. I'm
Especially a customer.
Stairs. Yeah. You call me up, and yeah, I can squeeze you in on a Saturday and a Sunday, and yeah, there you go.
Yeah. You might have to turn your Wi-Fi off and your phone off for an hour.
Yeah, there you go. All right. All right, anything else? We don't have to go any longer unless there isn't some more questions or comments.
Well, thank you, Amy.
Thanks for having me.
Thank you.
Hey, let's give Amy a big
Thanks
hand.
for listening. I hope you learned something valuable.
Oh, yes, you did a fine job, Amy. Thank you.
Thanks,
Thank
Paul.
Yeah. So, okay, everybody. Oh, I got next week, Tom Dormady is going to do, we're not talking about exercise. He's going to do his experience of backpacking in the Pecos Wilderness. And he has lots of pictures to show as to what his experiences were. And so we all know Tom, and he'll do a great job. And so that should be very interesting. So, okay, thank you, everybody.
Thank you.
Thank you.
Thank you.
All right, everybody. Thank you for coming. Have a good day.
All right, thank you, Sarah.
Bye-bye.
Bye.